The sensors and monitors generate an encyclopedic amount of information about what's going on in the body. The data are analyzed by sleep technologists, who produce a summary report for the doctor to review with the patient.
Entire night condensed into one tiny little screen.
We have the results of your sleep study.
After the sleep study, I met with my doctor again. Reviewing the report from the lab, she told me that I did have sleep apnea.
Was that you were actually having interrupted sleep 36 times in a 1-hour period during the study.
It was a relief to put a name to what was causing so many problems in my life.
That's the reason that...
But I needed to know what I could do about it.
Okay, well then, so what happens next?
Currently, there are a number of treatment options depending on the severity of the condition. We begin with lifestyle changes, such as losing excess weight, sleeping on your side rather than your back, and avoiding alcohol, sedatives, and cigarettes. In mild cases, these can sometimes be sufficient. Specially fabricated oral appliances can be used to keep the tongue in place and the airway open. People seeking a permanent solution sometimes turn to surgery. A variety of surgical procedures are used. Some are minimally invasive, but others involve excision of large amounts of tissue from the throat. As with all elective surgery, the risks and benefits must be carefully weighed. The treatment that is the most effective for the most patients is the use of pressurized air delivered through a face mask. Called CPAP, which is an acronym for continuous positive airway pressure, it keeps the airway open and the lungs full.
I went back to the lab for a second night study. The sleep tech fitted me with a CPAP mask and adjusted the pressure on the machine that blows the air. While it was not the most comfortable way to sleep, I noticed that I did feel more rested in the morning. I had misgivings about doing this at home every night, but I was willing to give it a try if it would help me get better. I was glad to know that there were many different styles of masks to choose from, as well as a variety of machines. I felt sure that I could find one that would be comfortable to use. My doctor had explained that heated humidification would also be a big help.
Treating sleep apnea can mitigate other serious health problems, such as cardiovascular disease, diabetes, and depression.
The doctor had told me that even with CPAP therapy, I might still experience some residual sleepiness, and that she would be able to help me resolve that. I can't say that it was easy getting used to wearing the mask, but I was able to sleep so much better. I could enjoy my life again. My job performance improved, and most important, I had my wife back with me. It's funny, since I was diagnosed, I found that a lot of people I know have sleep apnea. It's crucial that they get treated, and that's why I'm telling my story.
It took some time for me, but now I have a lot more energy, and I can make it through the day.
Am I 100% better? Of course not. But I feel like I'm making real progress.
If you're exhausted all the time like I was, see a doctor. I did, and it changed my life.